from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Welcome back, everybody, into Good Morning Arkansas. When you hear the word varicose veins, you might think of older people or something that happens whenever you get older. It's more than just appearance, though. It's more than something that you just see. It's something that you feel. Varicose veins can actually cause a lot of pain and discomfort. But the good news is you don't have to live with that pain, at least not anymore, thanks to the technologies we have today. And joining us to talk about this is Jacques Valley. She is a nurse practitioner with Baptist Health Vein Center and also a patient that knows firsthand about the pain from varicose veins. That's Chris Keeling. Thank you guys so much for coming in this morning.
Thank you.
Chris, let's start with you. You've gone through this, a cyclist nonetheless, so you are out there, you're active.
Sure.
Talk about what you were feeling before you visited Baptist Health.
So, for the longest time, I thought that, the real large vein in my leg was due to cycling because, of all the blood flow and things like that. And so I had it for probably 5 to 10 years.
Really?
And it seemed to be getting worse. And I was tired of the comments of people saying, wow, you look like you broke your leg or broke your foot, because it was, it was very discolored. And then it started to get quite a bit of pain after a long ride, 50-mile ride, 30-mile ride, whatever it was. And I thought, well, something's going on, because that's not normal. And so I went and saw my family doctor, and he said, well, you need to go see Jacques and Patty and the whole crew over there. And so I did, and I'm glad I did. I really am.
They talk about the difference now after visiting Baptist Health and how you feel now as compared to before.
I'd say, a lot of people say night and day.
Yeah.
And I would say it's night and day.
Really?
Because after a long cycling event, a really hard race or whatever it is, not much pain, and it looks better, because that wasn't important to me, but it definitely is visible, and definitely I can feel the difference.
And Jacques, what did you guys do? What procedure did you use for Chris that really made the difference for him?
For Chris in particular, we did laser ablation therapy where we generate heat to close the vein.
Okay.
This closes the vein and the blood can't go back through the bad vein, and so it provides relief for the patient.
Is this a non-invasive procedure?
It's minimally invasive.
Minimal invasive,
Yes,
okay.
there's no incisions that goes along with it. It's a series of needle sticks of numbing and getting the laser catheter in the right position.
What kind of recovery time are we looking at here?
A lot of people go back to work the same day.
Same day?
Yeah, we have a few physical limitations like no strenuous exercise for 5 to 7 days, but for the most part we want you up and walking and active.
So no riding 50 miles for 5 to 7 days?
That's right.
Chris is one of those who participates in a lot of strenuous activity as a hobby, as fun, and a sport. So that is one thing I know that was probably tough for you for only a week, though. And then after that, you really noticed a difference in cycling?
That was honestly my biggest thing. I kept on asking Jacques and Patty. I said, how long until I can get back on the bike?
Yeah.
And she's like, well, just take a break. Unfortunately, I went to go see her in the colder months.
Oh,
and so
okay.
I wasn't that discouraged. And the recovery was a bit of a challenge just because, it's a little stiffer than I was used to. And but a couple of Advil and a good night's rest. About a week later, I was kind of off to the races. And then I came back and did my second test. And they said, hey, you're good to go. And those were good things.
Yes, back on the bike now.
Right,
and back riding again. And Jacques, if someone is considering this, or who would be a candidate for this type of procedure?
So we want to, the patients that we want to see are those who have burning, aching, heaviness of the lower extremities, cramping, restless legs, swelling. You might have some discoloration, some varicose veins. Those are the patients that we consider.
Okay.
They come into our office. We do a full ultrasound screening to assess for venous insufficiency, and if they have it, there are a few conservative measures we have to take before we can do the procedures. But we also offer free screenings through the week.
Okay.
They can contact us at Baptist Health Vein Center, 501-202-4920 throughout the week, and we can get them scheduled if they're unsure if they fit the criteria.
Okay, wonderful. Well, best of luck to you as you continue riding, of course, and thank you for all the work you guys do there at Baptist Health.
Thank you.